Can the next presenter come on?
Yes, I'm here. Ready. Can I start now?
Yes, please.
Okay. Thank you very much, sir. So I'm going to discuss few cases of intrauterine familial exudative vitreoretinopathy as a presenting feature of congenital corneal opacity. So FEVR, as we know it as, is an abnormal case of retinal angiogenesis leading to incomplete vascularization of the peripheral retina and ischemia. How is it different from a ROP? Is because it can be seen in children who are term as well, and they do not give any history of oxygen exposure and blood transfusion, other risk factors of ROP. And it can be autosomal dominant, recessive, X-linked, and so far 14 genes have been known. And primarily it is a retinal disorder, and anterior segment changes are not well described in literature. So our aim is to describe a phenotype of FEVR with distinct anterior chamber findings. It was a comprehensive ophthalmic examination of children who presented to us with bilateral or unilateral corneal opacity, or on whom we did AIOS2025 and UBM imaging along with fundus changes of family members as a screening was conducted, and genetic data was collected as much as possible. So this is a case of a child with bilateral central corneal opacity with peripheral sparing, who belonged to an orphanage. That's why parents could not be screened, and he had microcephaly. Otherwise, all other features like tortuology, etc., was negative. Here we can see on AIOS2025 as well as UBM, there is on AIOS2025 there is a thick hyperreflective membrane suggestive of the iris plastered to the endothelium. Along with that, there is increased corneal thickness, and the UBM also shows here that there is some kind of calcified material stuck, most likely calcified cataract, and something else beyond that, some kind of tags which are going into the anterior vitreous cavity. Ultrasound shows this falciform fold, along with that retinal detachment in the right eye and multiple vitreous echoes in the left eye. So we wanted to go ahead with genetic testing, where we could find there was LRP5 mutation positive, suggestive of FEVR, and this child family, as I told, could not be screened. Coming to the second case, a unilateral case of a child who was only 5 months old. She also had the similar peculiar feature of increased corneal thickness with the iris plastered, along with that tags going into the anterior vitreous cavity, with ultrasound showing similar findings. Here on family screening in the mother and the older sister, we could see some subtle changes of FEVR with temporal avascular retina and dichotomous bandaging, but genetics in this case was suggestive of FBN1. Similarly, this is the third case where we are seeing the similar findings, and in genetics in this particular case was not positive, and I'm quickly going through these cases. This child had similar peculiar findings, and on family screening we could see the mother having this peripheral retinal changes along with exudation suggestive of FEVR. And another case with consanguinity, and there was presence of tractional bands again, and the father who had a full-fledged FEVR grade 2, type 2, and the child could not be called for further UBM testing. And this is another case who had LRP5 mutation positive with same findings as the previous cases, and mother was not available for screening, but the father had low vision since birth, suggestive of FEVR. So we had 6 patients, out of which 2 males and 4 females were present, and 83% of the cases were less than 1 year of age, and 5 cases were bilateral, and 4 out of 6 cases had FEVR changes in either of the family members, the parents or the family members. So the key learning points in this case teaches us that unilateral or bilateral corneal opacity with shallow anterior chamber and thick corneal pachymetry, in the absence of prematurity or oxygen delivery at birth, we must think of ruling FEVR in such cases, and you must do a detailed phenotypic examination along with ultrasonography and familial screening as well, and genetic screening if possible. Thank you.